Hello, I'm Dr. Mehta, and this is Sarah, my lead clinical assistant, and we're about to talk to you a little bit about your new palate expander.
Before we get into talking about how to do the turns, we want to make sure that we keep your expander clean. You're going to get your toothbrush and you're going to get your water pick. The water pick is to help get underneath your expander to help keep clean. Also, you want to make sure that you're using mouth rinse as well.
Okay, so now that we know how to do that, let's talk about turning this expander. So you have been given a recommended turning schedule. Typically, it's one turn every other night for 4 weeks, after which we would check you. Whether it's a virtual visit or an in-person visit, we'll let you know at the time. So here's how you turn this expander. So you have your child lie down on a sofa, chin up, pointing to the ceiling so you have good visibility of the expander. Then you take your expander key, which is this blue key that you're going to get, and you have this at about a 100-degree angle. So this is not like this, but it's at about a 100-degree angle like that. This little key has a bend, and the bend is where you would place the expander. That's how far the expander goes into the little key goes into the expander. So then you go ahead and imagine this in this position. You place the key into the little hole and turn the expander back towards the throat, not forward, always towards the throat. That's the direction in which the expander turns, is backwards. If you turn the other way, away from the throat, you're actually undoing the turn. So it's really important to turn the expander towards the throat. This is a very common thing that patients ask us. They get stuck with the key and they can't get it into the expander. So this is the way to do it.
Yes, also when you do turn your expander, space will occur between the upper two teeth. No worries, that's what we want to see. And then if not, if the space doesn't occur, we will check you at your next visit in 4 weeks. And then we will inform you if we need to continue the turns.
That's right. So a space appearing between the two front teeth is normal and expected. So we don't want you to worry about that. Another thing I want you to be aware of is what would you do if this expander were to come off? So it does happen on occasion. You must not eat hard, sticky, chewy things because that's what pulls these expanders off. They are being held in with glue, so it's important to be careful with that. But on the chance that it does come off, please bring your expander to your visit, call us, we'll get you in, and we'll replace it. If we lose the expander, we have to order a whole new one, and that takes a whole 4 to 5 weeks to get a new expander in. Sarah, would you like to talk a little bit about some of the common problems that we have with the expander?
So one of the common problems that most kids have is the gum tissue that gets inflamed. If you're not in pain, no worries, but if you are in pain, you would give us a call and we can be more than happy to take care of you.
It's fairly common for these wires that are up in the palate, kind of like you see in this area here, to tend to want to get embedded into the palatal tissue. Majority of times it's because the area is not being kept clean, and that's a response of the gum tissue to it's basically inflammation. So we would suggest warm salt water rinses, use your Oragel if needed, or your brace relief gel that you have, and essentially don't worry, don't panic. Another thing that we hear is the tongue feeling kind of sore from the expander, from the tongue pushing up against the expander. So again, that just takes some getting used to. Use your warm salt water rinses, use your brace relief gel if needed, and follow the same procedures. Keep your teeth and your expander clean and everything will be good.
If you have any questions or concerns on your expander, you can give us a call, email, or text, and we'll be happy to take care of you.
We're here for you. Bye.